Welcome to a short training video all about implementing workplace alcohol and drug programs. This information has been put together by the BC Forest Safety Council, and it is meant for companies who want an introduction to what alcohol and drug programs are all about. More detailed information is available on our website, www.bcforestsafe.org. Look for the Alcohol and Drug Resource Package, which contains excellent information and more details on these types of programs. If you're working for a forest company or licensee that is implementing an alcohol and drug program or implementing alcohol and drug program requirements for their contractors, likely they will be providing additional information and training to guide you along. So why is this a good idea? Why should you have an alcohol and drug program for your company? Well, first of all, there's some good business reasons. Workers who are affected or are using alcohol and drugs while at work are a hazard, and eventually they'll contribute to incidents which are going to cost your company some money. Having these types of workers on site will also drive away high quality workers that you want to keep around. Workers with substance use issues will likely be less productive and less reliable. And having workers with substance use issues will negatively affect the reputation of your business. Another good reason is a legal reason. Both the Workers' Compensation Act and the Occupational Health and Safety Regulation have sections all about impairment. There's a responsibility for the workers not to show up for work while they're impaired, but there's also a responsibility for the employers to make sure that they don't allow anyone who is impaired on their worksite. I want to share some stats with you as well. In 2002, a study was done in Alberta, and it said that 11% of workers reported using alcohol at work, and 1% of them reported using drugs at work, and the drug was primarily marijuana. Now, this study also looked into the forest industry, and they described the forest industry as a high-risk industry with workers reporting substance use at work, multiple substance abuses, and gambling issues. In fact, they said 14% of forestry workers reported seeing illicit drugs being used at the workplace, and 24% said they were available nearby. Young males aged 18 to 24 were reported as the most high-risk group for substance abuse. Now, those statistics are from a different province and are several years old, but I think you can agree that the alcohol and drug use problem in the forest industry in BC has not improved over the last few years. The last reason I want to share with you is a moral reason, and it's the most important reason. The people that we work with on a day in and day out basis are like family, and we want to return them back home at the end of the workday safe and sound. Eliminating alcohol and drug use in the workplace is going to help us do that. Here are some tips when you're developing your own program. The first one is to get supervisors involved right away. These are the people who are going to be implementing and running the program on the front lines for you, and you need to get their ideas and their input on what needs to be included in a program as soon as possible. Don't just copy another program. Sure, it can be valuable to have a look at other policies and procedures, but don't copy them 100% and just input them into your own program. Related to that is making the program useful. When you just copy another business's program and start using it as your own, it doesn't really meet your needs. Take some time and look at what some of the potential problems or issues are at your work and with your workers, and then custom make a program that is going to provide solutions for those problems. Last tip is keep it simple. Alcohol and drug programs and procedures and testing can get complicated in a hurry. There's nothing wrong with keeping it simple and small to begin with, and then expanding the program where you see there's a need in the future. When you first roll out your alcohol and drug program, you're going to do some training with the workers and the supervisors. Here are some ideas to keep in mind when you're doing this rollout training. The first one is explain why. Part of the training will be reading through and reviewing the exact procedures and policies that you've developed, but also take some time to explain why you're doing this. Explain what the benefits of an alcohol and drug program are going to be and how it's going to improve your business. Also, use scenarios to make it real. Just reviewing the procedures isn't going to make it hit home. Use real-life scenarios like what will happen if somebody is impaired by alcohol and they're operating a piece of equipment. What happens if you find drug paraphernalia or drugs in a pickup truck? Use those sorts of scenarios to explain what the program is really about. Allow time for questions and really welcome questions. If you can get a good discussion going, it will help explain the program and everyone will leave the training with a better understanding of how it's going to work. Let them know that help is available. A big part of alcohol and drug programs is providing people with the information and the resources to get help if they do have an alcohol or drug abuse problem. Finally, repeat this often. Repetition is key to making sure this information sinks in. Take the opportunities during tailgate meetings, during your monthly safety meetings, and even with one-on-one meetings between supervisors and workers to talk about this and answer questions. Some people might feel more comfortable asking their supervisor one-on-one about this type of program than talking about it in a big group training session. After you've started the alcohol and drug program, it's important to check back in with both the supervisors and the employees to see how it's working. Again, the supervisors are very important in this process. Check in with them, talk with them one-on-one to see if there's any gaps or if there's anything missing from the program. Also follow up with the employees. See if they have any questions, see if there's any concerns or problems that have been created with the implementation of the new program. Check with them for understanding of the program. Make sure that they have all the information that they need, both on how the program works and if they need help, where that help is available. Okay, let's look at the key components of a good alcohol and drug program. The first one is a policy statement. Your company will need a written policy statement, and the main reason why is just to make everyone aware, employees and supervisors, what the expectations are with the program. Now, every company's policy is going to be a bit different. However, they should include 4 key components. The first component is an awareness and education program. So workers and all employees need to understand this program. So an education program is needed both when it's rolled out or started off, and it needs to be ongoing as well. Second key component is the type of help that is available to employees. And those are employees with impairment or alcohol or drug use issues or problems. Now these resources or help could be available through employee assistance programs, could be through community resources, or it could also be through assessment services provided by a substance abuse professional, and we'll talk about substance abuse professionals later on. Training for supervisors is also a key component. They need to understand their role under the policy. So the training should include worker performance management for early identification of potential problems and the appropriate steps to take to investigate a possible policy violation. The other component is or are tools to investigate the violation of a policy. If there has been a violation of the alcohol and drug policy, everyone needs to be crystal clear on what needs to happen next. There should be no guesswork involved. All of those steps should be laid out in the policy and the detailed procedures. Be aware that you might want to look at other types of impairment when you're developing your alcohol and drug program and make it a bigger, broader impairment program. Things like fatigue from lack of sleep, over-the-counter medication or prescription drugs, even things like emotional upset or being angry are all causes of impairment and can lead to increased incidents at work. Many companies have identified jobs within their organization where it is critical that the employee is able to perform at a high level without any impairment or influence from alcohol or drugs. In the forest industry, there are many positions that fall into this safety-sensitive category, and here are some examples. Operating vehicles or heavy equipment, or even working around vehicles or heavy equipment, and any power saw work. Identifying and documenting the safety-sensitive positions will help focus your safety program by identifying high-risk activities. This will also ensure the employees who hold those jobs know what higher standards they are expected to meet when it comes to alcohol and drug use and fitness for work. The final point is making sure that the alcohol and drug program with your company matches up and agrees with any discipline policy. But be aware that if you have an employee that has a legitimate alcohol or drug abuse problem, they cannot be disciplined or fired because they have that problem, because it's considered a medical condition and you can't discriminate against somebody who has a medical condition. So in those circumstances, it's up to you and your company to accommodate them and help them as far as it is reasonable to do that. Here are some other considerations when you're building this type of program. If you have unionized employees, you'll need to make the union aware of this type of program and how you're going to implement it. Seek out legal advice. There have been numerous human rights hearings and decisions made when it comes to substance abuse at work, and getting a legal opinion on your program is a good idea. Substance abuse professionals are part of any successful alcohol and drug program. Substance abuse professionals can assess workers to see if they have a legitimate alcohol or drug dependency, and they're also key for developing back-to-work plans to successfully reintroduce that worker back into the workplace. Forest companies have introduced testing in a range of situations. The most common ones include pre-employment testing for safety-sensitive positions as part of an investigation into a reasonable cause situation, as part of an investigation after a serious incident, and as part of a monitoring program after treatment to support continued recovery for somebody who has an alcohol or drug abuse issue. You have to be very careful when you're searching company property for signs of alcohol or drugs. It is okay to search company property like a pickup truck or a piece of equipment, but you cannot go into a worker's personal belongings such as their lunch kit or a backpack. It is also a good idea to have another supervisor or manager with you when you're doing these searches. Who pays for treatment when a worker has a legitimate dependency on alcohol or drugs? It's a good question. The employer has the duty to accommodate the worker if there's a dependency, but this doesn't necessarily mean that they have to pay for the treatment. Finally, hotel or camp-based work can blur the lines between what is work time and what is personal time. Make sure that your policy and procedures clearly define when the policy is in place during work hours and when it doesn't apply on personal time. To wrap up this video, I wanted to remind you of 3 important things. First one is make the program work for your company. Customize it to address the issues or problems that you have with your company right now. Remember that the supervisors are key. They're the ones who really need to understand the program because they're going to be running it on the ground. And at the start, keep it simple. Start off with the policy. Make sure that it is solid before you move on to more complex issues such as testing. If you want more information, have a look at our Alcohol and Drug Program Resource Guide. The website address is up there for you to copy down and access that resource guide. It has a lot more detailed information and guidance that you will find helpful. Also, feel free to call the BC Forest Safety Council. Our toll-free number is also on the screen, 1-877-741-1060.